Now this is the one of the most important thing where reversible posterior leukoencephalopathy syndrome and posterior reversible encephalopathy syndrome. These are very interesting concept. Now we have a patient who has presented with accelerated hypertension. You can see these are the MRI images. So sometimes patients can get doubt, is it a CVT or a is it a CVT or a stroke? But this is from the internet. You can see you can differentiate easily. Only thing is it's a reverse. That's all. In diffusion you get hyperintense in stroke, whereas in ADC you get hypointense. Whereas in case of press or RCVS, you get the reverse. You get hypointense in DW1 and hyperintense in ADC. That is the carry home message in this. And these patients, usually you have to manage them properly with hydration. They do very well. You need not worry about it. Only thing is the mortality is very less. Only thing is you should be aware that patients can develop these in most of the patients who have preeclampsia and eclampsia. They can develop. These are the two complications where most of them are unaware of it. They think that it could be a CVT or as a stroke. So all these three can overlap. You can see preeclampsia, posterior reversible encephalopathy syndrome, reversible cerebral vasoconstriction syndrome, and HELP. All they can overlap, and most of them, because they all present after 20 weeks and before 6 weeks of postpartum. So how do you differentiate is by MRI, and all of them treatment is almost same. Conservative management, treat the patient, and in press most of them they present like seizures, whereas in RCVS they present like with a thunderclap headaches. So any patient who has headache, visual disturbance and seizures should raise the suspicion of press or RCVS. So most neurological deficits are reversible and they are caused by vasogenic edema, not by infarct. So of course the main causes are hypertension and calcineurin inhibitors like cyclosporin and tacrolimus. These are the drugs, and of course preeclampsia and eclampsia is one of the important cause for press. So renal failure, sepsis, and so many things, long list is there which can be accompanied in these patients. So always carry home message in this is press and RCVS, they have a good prognosis. You should suspect any patient who has a seizures in the third trimester of pregnancy, always. So this is the pathophysiology where there is an endothelial dysfunction because of many things. So that is the reason these patients they produce. And one thing is press can occur in the absence of severe perfusion scans. So severity of hypertension does not correlate with the cerebral edema. Previously they used to think hypertension is the cause. So hypertension need not be the cause. So many things are there as I have shown you. So endothelial dysfunction is the primary marker in this one, and what they say is increased nitric oxide production with cyclosporin and eclampsia may be the cause for these things. So treatment is gradual BP reduction in these patients, and calcineurin inhibitors, if they are used, it better stop. You can use anti-epileptic drugs. So as you know, seizures in eclampsia, most of the times we treat with magnesium induced, we treat with magnesium sulfate. Of course, this I think we need not teach you. Only contraindication in magnesium sulfate in pregnancy is myasthenia gravis patients. Better not to give magnesium sulfate in these patients. So most of the patients they recover very well. They recover within 2 weeks, and some of them they recover within 3 months. Mortality is very less, and clinical improvement precedes radiological resolution. So take home message: clinical setting and risk factors can give us clues to the diagnosis, and of course MRI improves later than the clinical prognosis. It has a low mortality rate. So of course I think there are so many things. I think I'll end my topic here because still so many things has to be discussed. I would like to have interaction with all of you. Of course headache is there, and the most important thing in headache, most of the times you have to suspect, most of them have benign headaches, and migraine is the commonest headache because of the change in the sleep. And the drug of choice most of the times, you can use, paracetamol is the most, acetaminophen is the safest drug in this headaches, and of course you can use other drugs also, better not after third trimester because of the patent ductus arteriosus. So there is so many slides are there. I think it is very difficult to finish, and the only thing is you should know the most important is post-dural puncture headache. after nowadays after epidural anesthesia and other things. So this post-dural puncture headache is one of the commonest headache we see. The clue is if the patient is having headache while sitting and it gets relieved after lying down. The treatment is give IV fluids, adequate rest. If it is not responding, you can give a patch. So of course, Bell's palsy you can see in some of the patients, that is because of the myoneural edema, because as you know there is an increase in the volume load during pregnancy and it is only conservative treatment. Most of them they recover after the delivery. And next is carpal tunnel syndrome. This is my last slide. Carpal tunnel syndrome is same thing like a Bell's palsy. Because of the hormonal treatment, there is a lot of fluid will be accumulated and they can have carpal tunnel syndrome, which is because of the median nerve compression in the wrist joint you can see. And most of them they get relieved after delivery. Very few of them they need intervention after surgery. So thank you. And if any further questions, you can contact me on this number. This is not for any reference. This is if anyone, because this subject is close to my heart. Many of them they call to me in the middle of the night. I am ready to answer because this is one of the favorite subject. I like it. That's the reason. Thank you.